All right. Hello and welcome incoming WashU students and your families. My name is Mimi Mudd, and I want to welcome you all to a pre-recorded edition of our Summer 2024 webinar series. I'm joined by two of my colleagues today, Dr. Cheri LeBlanc, who's the Executive Director of the Habif Health and Wellness Center, and Dr. Tom Brounk, who is the Director of the Center for Counseling and Psychological Services. Thank you for joining us for this conversation about health and well-being. I'm going to go ahead and turn it over to Cheri and Tom to share some information and overview of their center's resources and services.
Great, thanks, Mimi. If we can advance the slide, there we are. So here at Washington University, we provide comprehensive and integrated healthcare. We have three major departments: medicine, psychiatry is part of medicine, that I oversee, counseling and psychological services that Dr. Brounk oversees, and health promotion, which is also actually under my purview. We're located on the South 40 in the lower level of Dardick House. So that is on the residential campus where all of the undergraduate, certainly all of the first-year undergraduate students live. Very convenient for your students. Our hours are Monday, Tuesday, Thursday, and Friday, as you can see on the slide, from 8 to 5. We hold weekly meetings on Wednesday mornings, so we open at 10 on that day and close at 5. After hours for both medicine and counseling and psychological services, our after-hour support is provided by Timely Care. That's available to all students, and they are able to see a provider on either side virtually if something is needed when we're closed. I'm going to continue and talk about medical services before we turn it back over to Dr. Brounk. So we have pretty comprehensive services for your student. We see routine preventative care, urgent medical care. We do reproductive health care, sports medicine, travel medicine, and of course, we have a group of psychiatrists on staff as well. We have both physicians and physician assistants and nurse practitioners to see your students. All of our physicians are on faculty at the School of Medicine. They're board certified in various areas. You can see on the screen: internal medicine, family medicine, adolescent medicine, psychiatry, travel and sports. So very knowledgeable and experts ready to see our students. We also have radiology on site for plain films, chest x-rays, limbs, if people have strains, sprains, breaks, things like that. We have a full service lab and also a pharmacy here on site. I want to just briefly touch on some of the requirements that are here for your students. They are here up on the slide, but all incoming first-year students are required to have several immunizations: 2 MMRs, which are measles, mumps, rubella, after the age of 1, meningitis after the age of 16. So if your child got a meningitis shot around the age of 12 or 13, which occasionally happens, they will need a second one after the age of 16 to protect them from meningitis throughout their 4 years here with us. For those who may have been in a country endemic for tuberculosis, there is a screening that every student will take, but if certain questions are answered in a positive manner, they will also be required to do a TB skin test or TB blood test within 6 months of matriculation. The other requirement is for every Washington University student to have health insurance. Many of our students, especially incoming students, may continue on their parents' insurance, but we also offer a student health insurance plan with, again, the option to waive out if your current plan meets the requirements that Washington University sets out. You can waive off the plan. As you can see, it's a pretty hard deadline. I will emphasize that. They wait to waive out of the school's insurances between July 1st and September 5th.
Okay, so I'm going to talk a little bit about what we offer on the mental health side of things. First, we have a very multidisciplinary team of professionals, including psychologists, professional counselors, and clinical social workers. They are all licensed, accredited, provide mental health services in the state of Missouri. In addition, we also have what we call a care manager. So that is someone that helps connect students to services either internally here at CCPS or in the nearby community. Not all issues that students present here are ones that maybe we could help with. Sometimes students are wanting or needing something a little bit more intensive, or they're wanting a particular specialty that we don't offer, and that is where a care manager can assist. Students are eligible for up to 9 free visits, so there's no cost for the care that they receive here for those first 9 visits. There's an additional number that are available to students, and that would be at the cost of whatever the insurance carrier, what the reimbursement is for the insurance carrier. And then we also have an urgent care counselor who's available every hour really that the Habif Health and Wellness Center is open. So students do not have to wait. If they have an urgent concern, all they need to do is call us. Let us know that they'd like to speak with somebody today, and we're able to get them in. A range of services include everything from individual, some couples work if the student's wanting to work on a relationship issue, as well as some group counseling. Probably our most common form of group therapy that we offer are called interpersonal process groups, and that's really to assist students in some way, shape, or form if they want to work on a relationship issue. Maybe they're having difficulty with making connections with others. They're having difficulty with maybe sharing fully, sort of there's anxiety that gets in the way of their ability to really make connections. So those are all very important issues that we're addressing in the context of group counseling. We also offer the crisis response. I already mentioned that there's no wait for a student that really needs to talk to somebody that day. We feel very fortunate to be able to offer that level of care for our students. And lastly, as I already mentioned, the referral piece, where if we're not able to provide that service here, we help students do a warm handoff, make a warm connection into the community that can be sometimes a challenge. And we have the person here that can help to make that transition. And I wanted everyone to be aware of this resource. It's called Thriving Campus. It's available on our website. And this is something that actually, if you, your students, are thinking that, I have really benefited from being able to talk to somebody, to talk to a therapist in an ongoing way without having to be concerned about, limits to the services that we can provide. This resource will help you to connect with clinicians in the community. It builds off of our knowledge base here at the Counseling Center, as well as other counseling centers in St. Louis. And then if your son or daughter ever needed to make a connection while they were, let's say, doing some sort of internship elsewhere or during summer breaks, this can also be a very helpful resource. I think that concludes my portion.
Great. Thank you both, Cheri and Tom, for all of that information. Now we have a couple commonly asked questions in order to dive in just a little bit more. So first question is going to be for you, Cheri. Can you elaborate a little more on the student health insurance plan and waiver criteria? And if they were to waive out of the student health insurance plan, can a student still be seen at the health center?
Sure. The second part of that question is quicker and easier, and it is yes. You do not have to have the student health insurance plan for us to see you. We will absolutely see your son or daughter on the insurance plan that they have, because we go through this waiver process, which I'll talk about in a minute. If you have been allowed to waive out of the insurance plan that this the university offers, we know that your plan also covers what we are able to provide for your students. So yes, please encourage your student, whether they're on our plan or not, to come and see us. So the student health insurance plan, just to know, all full-time students are automatically enrolled in this insurance plan. It's underwritten by United Healthcare. The policy is a non-renewable 1-year term policy, and is effective annually from August 1st through July 31st. So it's a year-round policy. It just automatically changes year to year. You are automatically enrolled in it year to year. It also means if you want to waive out, you need to do that every year because it is a non-renewable policy. The premium is charged to your student account in the summer. It will be reversed if that coverage is waived. It does not include dental or vision. It's a straight medical plan. So if you are needing that, you will need to have separate dental or vision insurance that is available through the United Healthcare, but you would need to do directly with the insurance company. So to waive out of the student health insurance, your current plan has to meet university criteria. For example, the plan needs to be ACA compliant. It needs to offer preventative care with no cost to the insured. It has to include both inpatient and outpatient care for medical and mental health care concerns in St. Louis. It cannot just be emergency care while out of state. It needs to have prescription drug plan, diagnostic imaging and testing. All of this information is on our website, and I really encourage you to go into our website, look at what the insurance plan for the student health insurance plan offers, look at your own plan, look at what the waiver criteria are, and really make that decision on what insurance you want your student to have. The waiver period is from July 1 to September 5th. Instructions are sent to your student on how to do this. The waiver tool is found in WebStack. This is a hard deadline. You cannot waive out of the insurance after September 5th. So those are the major take-home points about the insurance and waiver that I'd like to just talk about here. But I really do encourage you to spend some time in our website. There's a lot more information about this there.
Great, thank you. Okay, next question is for you, Tom. So what should a student do if they need mental health services, but CCPS is closed?
Yeah. So this goes back to what Dr. LeBlanc was talking about earlier on that third-party vendor that we work with very closely, Timely Care. So this will be something that is being talked about quite a bit during the orientation period. Students are encouraged to download that Timely Care app and then register using their email address. There's only a few questions in it to actually get registered now. It takes maybe a couple minutes. But we encourage students to do this really right at the very start of their time here. So we don't want there to be a situation which, you know, maybe a student's experiencing some level of stress and they're also trying to navigate the registration process. So as soon as this becomes available to the student, we encourage them to register. And that way, when an issue does arise outside of hours, and you know, it's hard to know when that will happen. So be prepared. All they'll need to do is really open up their phone and or their laptop, and then click on the Timely Care app. And then what you want to direct the student to is the Let's Talk or the Talk Now version. There's many different sort of offerings through Timely Care, scheduled counseling, but the one also psychiatry visits. But the one they'll want is the Talk Now option. And typically there's maybe a 3 to 4 minute wait is the average time frame for when a student can get connected. But then once they are, they'll be able to talk with someone that's trained to respond to urgent types of issues. Maybe it's just somebody wanting somebody to listen. And so it doesn't necessarily have to be an urgent emergency. but they could talk for 15 or 20 minutes with that counselor. So that is really what I would encourage, and if something more serious were to occur, then you'd want to be summoning our police.
Great, thank you. Okay, Cheri, last question for you. Will parents or family members be notified if their student is seen at the health center?
This is such a common concern with parents of incoming first years, as you're all used to kind of being intimately involved in your child's healthcare needs. First of all, if your child is under the age of 18 when they enter WashU, we will still be calling for permission to see and treat your child, and we'll discuss their care. But after the age of 18, we need the student's permission to contact you. And we'll partner with you in their care, but only if the student wishes that as well. It's important as they enter this emotionally charged developmental stage where they're exploring their identity, navigating new social and sexual situations, that they can look at us as the confidential experts and come to us with any concern they have, knowing we'll keep this information strictly confidential. And so we really abide by this. But again, many times I notice if I go in to see a patient, you all are on the other end of their cell phone already in the visit with us. I mean, if a student wants you involved, we will involve you. But again, as you know, it's hard to let go, and I understand it. But it's going to be time for students when they reach this age to start taking their healthcare into their own hands. That said, if we see a patient and I think they need to go to the emergency room because they need immediate care, I'll encourage them. Why don't we call your mom and let her know that this is what we're doing, and I'll talk to you at that point. If your student is incapacitated, they're unconscious, they're found on campus, they're sent up to the emergency room in that type of situation, you as the next of kin will be you'll be notified by the residential life folks. You'll be notified by the hospital where they're sent to, because you're next of kin. So I do want to try and reassure you in that way. We have a release of information form that is on our website. And if you want your student to sign that, that gives us then permission to call you, discuss their care, and so on. You can certainly have them do that. What I would say is this release of information form is then in our chart, but it's not in the chart where I'm going to be seeing your student, where I'm going to be writing my notes, where I'm going to be doing things. And our default as providers is that we don't call a parent of someone over 18. So remind your student to say, my parents want to be involved. I've got an ROI release of information on file, and we'll be happy to do that. Tom, did you, I want to give you an option to kind of weigh in a little bit on this, because I think it's slightly different on counseling, on the counseling side.
Sure, thank you. And let me underscore that we are always wanting to work with parents and involve them to the degree that is helpful to our ability to assist your students. That's something that we consider parents our partners. There might always will be valuable information that could be shared. So we're always able to receive information from you. In terms of the release of information, once a student is actually a formal client with us, we're glad to have conversations and talk and share our perspective, as long as we have the informed consent of the student. And that needs to be given on a case-by-case basis. So we're perhaps, as long as your student is wanting us to be engaged with you and talking with you, we're glad to do that. We just have asked them to sign that consent form. If that isn't signed, rest assured that if there were to be an emergency of some sort that were to arise, we will, the university will make contact with you. If your student is transported to the emergency room and being treated there and admitted, that would be a situation which is standard protocol for the university to be contacting you as a parent, so that you're aware and involved to the degree possible.
Great. Thank you both so much for speaking to that, because I do know that's definitely on a lot of parent and family members' minds. Okay, Tom, last question for you. What would happen if a student experiences a mental health emergency and needs to be hospitalized? You can speak to more of that.
Yeah.
And then what do you recommend a family member do if they know their student is experiencing like an emergency or a crisis?
Okay. So in most cases, a first-year student's going to be living in the residence halls. So typically, a residential life staff member would be somebody that would be involved if it's really an urgent situation. So they could help to coordinate the transportation to the emergency room. Our Washington University Police, unless there's a need for an ambulance transport, Washington University Police are all trained in what's called critical incident training. So they are able to assist and transport a student in a way that is to the degree possible, private, confidential, and it's not licensed science. So if it's a situation where it's after hours, it would be our Res Life team that would be involved in helping to get your student to the ER. If it's after hours, then it might be our timely care service that could be arranging for that support, the transportation to the hospital. They have the ability to connect with our Washington University Police Department after hours. So there's a very streamlined process for getting students the urgent care that they would need. And then as a parent, if there's a situation where you were becoming aware of a situation, and it was urgent, where there was a safety, issue, you're concerned about the safety of your student. Those situations that would probably be most quick to get the assistance would be to call our university police. So that would be 314-935-5555. And then they will actually work in unison with our residential life staff. They will go to the room. It'll be Res Life staff that will be really sort of taking the lead, and the police are there really just to ensure safety of everyone and to help get the student to the ER.
Great. Okay. Thank you both, Cheri and Tom, for those answers and the information you all provided. Parents and families, we hope you found this video informative and enjoyed the pre-recorded option of our summer webinar series. Before closing out, I do want to plug our next summer webinar series webinar, which will be a conversation about student financial services, which is a live webinar on Tuesday, July 16th at 5:30 p.m. Central. We hope to see you all there. And I just want to say thank you again to Cheri and Tom for joining us. And I hope you all have a good rest of your day or evening. All right. Thank you.